Hello everyone. So today we are going to discussing about the CBT questions. Questions number 21. Questions is what laws should be taken into consideration when a patient has hearing difficulties and would need hearing aids? Option A is Mental Capacity Act. Option B, Equality Act. Option C, Communication Law. Option D, Children and Family Act. So uh, for these questions, as we know, the Equality Act 2010 protect individuals with disability, including those with hearing difficulties, ensuring they have access to necessary aid and accommodation. So, questions number 21, this one, option number B is correct answer. So, for the question number 22, hearing aid provided to client come under which act? Option A, Communication Act. Option B, Mental Capacity Act. Option C, Children and Family Act. And option D, Equality Act. So, for these questions, as you can see, option D, Equality Test is the correct options because it provides hearing aids aligned with the Equality Act, which mandates equal opportunity and prevents discrimination for individual with hearing impairment. So option D is the correct answer. So for the question number 21, Mental Capacity Act 2005 explore which of the following concept? Mental capacity, advanced treatment to decision, and acts code of practice. Option B, mental capacity, independent mental capacity advocates, and the acts codes of practice. Option C, mental capacity, advanced treatment decisions, independent mental capacity advocates, and the act code of practice. And option D is mental capacity and the possible ethical and legal dilemmas in its interpretation. So, for the question number 23, the correct option is option C. Mental capacity, advanced treatment decision, dependent mental capacity, advocates, and acts code of practice. So, for the question number 24, an inquiry was launched involving death of one of your patient. The police visited your unit to investigate. When interview, which of the following framework will best help assist to investigation? Option A is Data Protection Act 2005. Option B, Storage Record Policy. Option C, Consent Policy. Option D, Confidentiality Guidelines. So for the question number 24, as we know, confidentiality guidelines ensure of appropriate sharing of patient information in legal investigation while maintaining ethical standard. So question number D is the correct answer, which one is confidentiality guidelines. So for the question number 25, which of the following statement is the false? So option A is abuse mostly happened in the nursing and residential home. Option B, abuse can take place anywhere there is a vulnerable adult. Option number C, abuse can take place in the daycare center. Option D, abuse can carried out by anyone's doctor, nurses, care, and even family member. So for the question number 25, correct option is the option number B. Abuse can take place anywhere there is a vulnerable adult. So question number B is the correct option. Question number 20 is the during the day, Mr. X was sat on chair and has a table put in front of her to stop her getting up and walking about. What type of abuse is this? Option A is the physical abuse, option B is the psychological abuse, option C is the emotional abuse, and option D is the discriminatory abuse. So for the 20 number 6, this is a physical abuse. Question number 27. Michael feel very uncomfortable when the carer visiting him always gives him a kiss and holds him tightly when he arrives and leaves his home. What type of abuse is this? Emotional abuse, option B, psychological abuse, option C, discriminatory abuse, and option D, sexual abuse. So for question number 27, this is a types of sexual abuse. Then for the question number 28, uh, Anna has been told that unless she does what the ward staff told her, the consultant will stop her family from visiting. What type of abuse is this? Option number psychological abuse. Option number B is discriminatory abuse. Option number C, institutional abuse, and option number D is the neglect. So for the 28, it is the psychological abuse. So, using threat to manipulate or control behavior is a clear example of the psychological abuse. So, 428 is it is the type of the psychological abuse. Question number 29. Christine cannot get herself a drink because of her disability. Her carer only gives her drinks 3 times a day, so she does not wet herself. What type of abuse is this? Physical abuse, institutional abuse, neglect, option D, sexual abuse. So for the question number 29, it is the neglect. Withholding adequate hydration intentionally is neglected as it deprives the individual of the basic need. So it is the neglect. For question number 30, for question number 30, Gabriela is a 26-year-old woman with severe learning disabilities. She is usually happy and outgoing. Her mobility is good. Her speech is limited, but she is able to involve in if carer take time to use simple language. She lives with her mother and is being assisted with personal care. Her home care worker has noticed brushing on the upper inside of the heart, thigh and arm. The genital area was red and sore. She told the care worker that a male care worker is her friend and he has been cuddling her, but she does not like to cuddling because it hurts. When what could possibly be the type of abuse Gabriela is experiencing? Option A is the discriminatory abuse, B financial abuse, C sexual abuse, and D institutional abuse. So, this is the sexual abuse. The physical sign and Gabriel's report of discomfort indicate potential sexual abuse requiring immediate investigation and intervention. So if you like this channel, you can subscribe it. Thank you so much.